of ventilation. Which joints are active when we breathe? One of the active joints are the costovertebral joints. The rotational movement of this joint allows the ribs to go up and down during breathing. The costovertebral joints are the articulations that connect the heads of the ribs with the bodies of the thoracic vertebrae. The connection of the ribs and the vertebrae occurs at two places: 1. Costocorporeal joint, and 2. Costal transverse joint. On the other side of the rib is joined to the sternum through the sternocostal joints. The sternocostal joints are synovial plane joints of the cartilages of the true ribs with the sternum. We can see the flexibility of the joint, which enables rotation and movement in the chest. A focused look at the sternocostal joints and costochondrial joints. Other joints that participate in breathing are, of course, the thoracic spine vertebrae. Note, there are a few active joints that are not displayed in this video. A front view of the active muscles during focused inspiration. The scalene anterior, medius, and posterior muscles increase interthoracic volume by elevating the upper ribs and attached sternum. The scalene have been observed to be active during quiet breathing and forced inspiration. Sternocostal-mastoid muscle. The sternocostal-mastoid elevates the sternum, increasing the anterior-posterior diameter of the chest. Pectoralis major muscle. The pectoralis major muscle with great force the anterior chest, lifting up ribs and sternum and increasing thoracic AP diameter. AP anterior-posterior. Intercostal muscles. These muscles play an important postural as well as a respiratory role. During inspiration, the shaft of the ribs and the sternum elevate. Diaphragm muscle. The diaphragm is the most important muscle of the inspiration, performing 60 to 80% of the work of the ventilatory process. With the lower ribs stabilized, the internal contraction of the diaphragm causes a lowering and flattening of its dome. This action is the primary method by which the diaphragm increases interthoracic volume. Latissimus dorsi muscle. The latissimus dorsi increase interthoracic volume by elevating the lower ribs. Requires the arms to be fixed. Serratus posterior superior. This inspiratory muscle expands the chest by raising the 2 to 5 ribs. Erector spina muscles. The thoracic erector spina muscles extend the thoracic spine and aid inspiration by raising the rib cage to permit full extension of the chest. As the ribs elevate with deep inspiration, the thoracic kyphosis opens and flattens. Levatorus costarum. The levatorus costarum elevate and abduct the ribs. Serratus posterior inferior. The serratus posterior inferior stabilizes the lower ribs for initial contraction of the diaphragm. Usually, it is considered to be an accessory muscle of expiration, although some research lists it as an inspiratory muscle. Quadratus lumbarum muscle. The quadratus lumbarum stabilizes the lower ribs for contraction of the diaphragm during early forced inspiration. The quadratus lumbarum holding down the 12th rib so that it is not elevated along with the others during respiration. Mechanism. Elevation and depression of the ribs and sternum produce changes in the anterior-posterior and medial-lateral diameters of the thorax. The upper 6 ribs elevate slightly more in the anterior direction. In this animation, we can watch the rib movement in all directions. We can compare the rib movement to that of the handle of a pail.